Hi, this is Ashley from DCB, and I'm going to do a Picc line, blood draw, and flush. So first I'm going to check my MAR and make sure that this treatment is ordered, and then I will make sure that I have the right patient. I'll obtain all my supplies. I'll go into the patient's room. I will explain to the patient what I'm going to do. I'll perform hand hygiene, and then I will don gloves. Have gloves on, and then I will get my supply set up. So you're going to assess your IV site, make sure there's no complications like phlebitis or infiltration or anything like that, because if there's that, then setting up your supplies will be irrelevant, because you need to relay that to the provider that that's happening. And then you want to make sure that this patient has the chucks underneath their hands, because you're drawing blood back, so you want to just make sure that that's there. So first I'm going to get my flushes ready. So you make sure that you have a 10 ml flush for this type of flush, because that's the protocol. And then I have my new cap, and I have a couple other flushes. And I'm going to change the cap. So I'm going to open up my flush, and then this flush has a cap on the end of it. And then I'm going to open up my new cap here. I'm going to pop that cap off, and then I'm going to connect it to the new hub, and I'm going to prime it. I'm going to prime that hub and make sure that there's no air. Then my other saline syringe, I'm also going to prime that to make sure there's no air. Then I'm going to open up my empty syringe for my blood. So first I'm going to make sure these guys are clamped. Then you're going to clean each area for about 30 seconds with different alcohol wipes. And once you do that, you can pull this. You're going to be pulling blood out of here. So you're going to take your first saline syringe out, and then you're going to unclamp it here, and then you're going to hook it up. You're going to aspirate for blood return, and then you're going to pulse your 10 mLs of saline in there, okay? So you pulse your 10 mLs of saline in there, and then you're going to pull back your discarded blood. Per whatever lab orders or wants you to discard, that's what you're going to discard. And then you're going to clamp it, and then you're going to take this off, and you're going to discard it in the sharps or wherever it needed to be. And then you're going to put your empty syringe on. You're going to unclamp it, and then you're going to pull back your blood that's ordered. And you're going to do that in whatever speed. Usually it's pretty tough to pull back. So, and then you're going to clamp it again, and then you're going to take that off. You're either going to hand this off to lab, or you're going to put it in its own lab container, and you're going to label, date, and do everything that is necessary to this tube to make sure that this patient's information's on here and this is their blood, and that will get sent to lab. So once you do that, you'll have that done, and then you'll hook up you'll take off your old cap. You'll discard that. You will hook this one up. You'll unclamp it, and then you would flush with the 10 mLs, and then you'll clamp that off, and then you'll take that off, and discard that into sharps, and then you'll make sure both of these are clamped, and then you have your hub changed, you have your flushes done, you have your blood draw, and then like I said, you're going to make sure that you are doing the appropriate things with your blood, and then you will document, and that's it. Thank you.